So what are you doing for joint pain?
You know, I got to tell you, joint pain is one of the most common things that we see. Okay. Arthritic hips, knees, even elbows and shoulders, a very common pain problem. So there's a lot of things that can be done, right? You know, we try simple things at first, physical therapy, you know, maybe some, there's some chiropractic adjustments and stuff that can be done with some people that we work with, medications and all that. But we have some unique things that have just come out. Now, particularly, let's talk about the knee, for example. Very recently, we learned that there's 3 nerves that supply that knee joint. Just so you know, they're called the genicular nerves, but those nerves can be blocked. What that means is we do a procedure where we take you under x-ray. This machine comes in, lets me see everything in the knee. We take some needles, you're numb so you don't feel this part, but we put them into those nerves and we inject medicine to block that nerve. Now, if that works, theoretically, your pain should go way down. And it's very effective for people that have chronic knee arthritis, or they've had total knee surgery and they still have that chronic pain, didn't go away with the knee replacement. So we do this block. And if this block works and lasts a long time, we're done. But if it works and then wears off, which sometimes happens, there's another new technique called a genicular radiofrequency ablation, which is a way we can actually burn or cauterize some of those nerve endings, and that can provide prolonged pain relief.
By doing this, you're kind of blocking or interfering the pain signal to the brain?
Correct. So we're blocking just those nerves that provide chronic pain to the knee. So if we do an ablation, your knee's not going to get numb. If you touched your knee, you'd still feel all of that. If you were to twist it and hurt it, you'd still feel that sharp spike of pain because we're actually blocking a different nerve fiber there that is more involved in sending the chronic, the long-term, that burning long-term pain.
And then, is this something that can last 2, 3, 4, 5 years?
Yeah, so typically it lasts around a year, plus or minus 6 months. So the range would be 6 months on the low end to 1.5 years on the high end. Actually, what happens, believe it or not, is those nerve cells do grow back and heal. And when they reattach themselves, sometimes the pain returns. But it does provide long-term pain relief, all done through a needle stick. And actually, this type of approach of doing these nerve blocks can be done on a lot of different joints. And I mention this as a potential therapy because, look, everyone knows about cortisone shots, right? And they know about a lot of the other stuff out there. But what I think a lot of people may not know about now is this approach of doing a nerve block followed by an ablation as an opportunity.